Hi, thank you. I'd like to introduce boys and girls Ms. Sharon Barrows. Uh, Sharon, thank you for participating in the 2019-2020 school year career fair at
Thank
Speedway Academies. Thank you
No,
for coming, joining.
you're more than welcome.
Um, Please introduce yourself by your name, your title, and description of the job that you do.
Okay, my name is Sharon Barton Barrows, and I currently work for Staten Island University Hospital, that is also known as Northwell. And what I do there, I work in an outpatient rehab department, and I am a registrar/scheduler, which pretty much means I register patients and I schedule them for their upcoming appointments. I have been in that job for almost 18 years.
Wow.
Yeah, long time.
Please explain the career path you took to arrive at your current position, including previous jobs that you gave, the experience and skills you needed to get the job, to obtain the job, as well as many educational requirements.
Okay, well, I can begin. Uh, I was currently employed at New York City Police Department, and I was a 911 dispatcher in those days. I've been with that department for 13 years. Um, I love that job. The job was very rewarding. Like I said, I was a 911 dispatcher. I love it. It was really rewarding for me. I was able to help people, all 5 boroughs. It was really good. You was able to work with certain dignitaries. Like I worked with the mayor at one time, and it was very, very rewarding. I love that job. I love that job. But unfortunately, I had to resign because I had to start homeschooling my middle son. And if anybody know about middle child syndrome, you know what I mean. So I did just that. I homeschooled him for 3 years throughout the junior high school time. And during that time, had to work, but I was able to get a job with an agency. It's called YEPS, YPIS. It's a government funding program. And I was allowed to get work there because I had to homeschool my son, and I needed to have something, money coming in as well. So I started working with that program, which, mind you, my friend Sheila, she was part of that program. And I was a parent liaison, which I was dealing with children, teenagers, basically, in the high school, which was at McKee High School. So I was able to bring my son to school with me and work and be able to provide. So that was I love working with children. I love, love, love working with children. That is my passion, children of all ages. And the teenagers they can be a little, trying, but they're good. I love it. I love the job. So unfortunately, with that particular job, they lost the funding. And that took me to go in to apply at Staten Island Hospital. I started as a temp. I went to a temp agency. I was temping for like a year or so. And after that year, they pretty much brought me on board, gave me a full-time position. So I have been there at Staten Island Hospital for 18 years. I have a high school diploma. I have 1 year of college at Hunter College. The criteria basically is the same: high school diploma. If you got some colleges, fine, depending on what job you're going to apply for at the hospital. But my job currently, it was okay with having a high school diploma, was more than enough.
Wow, thank you. Describe a typical day on the job.
Okay. All right. A typical day at Staten Island Hospital. Okay. In the outpatient rehab department, we have a lot of different departments. And like when I say outpatient rehab, it's like for people trying to get back on their feet, with the physical therapy, the occupational therapy, speech therapy, and neuropsych. I'm going to explain the physical therapy. Physical therapy is for your lower extremities, your legs, your knees, and occupational therapy is your upper extremities, with your arms, your shoulders, your neck, your back, all of that. Speech is self-explanatory. Some people lose their voices depending on what type of injury they have come in with. Neuropsych is definitely with there's a lot of couple of avenues with neuropsych. You have people coming in with concussions of all ages, even children. You have people coming in with behavioral issues. That's another thing. And we also have people we have our older population that have a lot of memory loss. So pretty much we have a lot of different things under that umbrella. So that being said, usually when they come to outpatient rehab, the patients are the stroke victims, heart attacks, car accidents, motorcycle accidents, like I said, concussions from children to adults. And it's a lot. It's a lot. And they come to get better. They come to get the therapy that they need to make their life more productive, because right now they're in a struggle. So also we have an audiology department, that audiology meaning hearing. We have a full hearing department, again, for the ages of children to adult. And that department is very, very, very rewarding to me, because like if you've never lost any of your five senses, you're not going to understand, because a hearing loss is a big part of your life. Like losing your vision is a big part of your life. So when you lose your hearing, you're not even sure what to do. It's a panic mode. And some people are born that way. Some people happen to lose their hearing through their lifestyle, like their lifespan. Some people lose their hearing from an accident. So, it can be very, very traumatic, but not having your hearing. So it's so important to make sure that you get these people, these patients, very much so set up on board, getting hearing aids, and have a productive life. So pretty much that is my day. When every day, that's my day basically. We're just there to be helping people get back on their feet, get their life back together. They come in one way. They come in very, broken and mentally and physically, and they think they will never get better. But then when you see the blessings that they leave there graduating, basically, they always say, I'm graduating my last day. When they graduate, like basically, and they look better, they feel better, they're doing better in their life, it's a blessing. It's a blessing. And
Wow, meaningful work. Thank you. What is your least favorite aspect of your job, and what is the most enjoyable aspect of your job?
Well, my least favorite aspect is when I think I couldn't really find what was my least favorite aspect, but I think I'm gonna say, like, we have to use our security guards too often, and I don't like to do that, because we try to give each patient a chance to calm down, to recollect, to be able to, because they come in with different situations, and unfortunately, we have to have some help sometimes. So that's my least thing. I don't like calling security if I don't have to. And my most rewarding thing during the day, like I stated before, I just really enjoy seeing the patients coming so far in their treatment. It's like months, but just to see them get so far to the point that they are better, not 100%, but almost 80%, and it's a blessing. Even with their speech and their mobility, it's really just a blessing. It's a reward, and that's I love that. It's like our own little bit of miracle, So it's great.
Wow, well, you're doing great work. I want to thank you for taking the time to participate in our virtual career fair. Ms. Barrows, boys and girls, say bye.
Bye. Thank you. Bye.
Thank you. Bye-bye.